Florida announced a plan to ban all state vaccine mandates. This followed declining vaccination rates across America and a return of measles, a disease that had been 25 years ago declared eliminated. But the continued use of vaccines did get a healthy boost from none other than President Trump, who seems to accept the overwhelming consensus of the medical community, which is that vaccines are safe and effective. Here is how President Trump responded to Florida's decision on Friday.
You have some vaccines that are so amazing. The polio vaccine, I happen to think, is amazing. A lot of people think that COVID is amazing. I think you have to be very careful when you say that some people don't have to be vaccinated. Look, you have vaccines that work. They just pure and simple work. They're not controversial at all. And I think those vaccines should be used. Otherwise, some people are going to catch it and they endanger other people. And when you don't have controversy at all, I think people should take it.
Joining us now is the Surgeon General of the state of Florida, Dr. Joseph Ladapo. Dr. Ladapo, thank you so much for joining us. You just heard President Trump say that if a state were to remove vaccine mandates, quote, that other people will catch it and they endanger other people, unquote. So obviously, you think that President Trump is wrong?
You know, I'm not sure that I agree with you. Actually, I'm sure I don't agree with you in terms of what President Trump said. You know, there's some confusion about what we said. We're not taking vaccines away from anyone. What we said was that if you want them, God bless you, you can have as many as you want. And if you don't want them, parents should have the ability and the power to decide what goes into their children's bodies. It's that simple.
So as you know, the medical community really disagrees with your position in general. Your predecessor, former Florida Surgeon General Scott Rivkees, criticized your plan. He warned that, quote, children in Florida will now be more at risk of vaccine-preventable illnesses than at any time in recent history. And he says it's not just Florida children that you are putting at risk, but you're also putting at risk the entire broader U.S. population. What's your response to him?
Yeah, so, you know, Dr. Rivkees was my predecessor here at the Department of Health, and it's a great, there's a lot there. And I think, first of all, it's important to remember that there are countries out there that don't have vaccine mandates for school. Sweden is an example of a country like that. The United Kingdom, I believe, is another example. I think Denmark also. And guys, the sky is not falling over there. So the whole idea, I mean, do you not believe that parents are incapable of making decisions with the information that they receive from their pediatricians? Because either you don't believe that parents can make good decisions for their children, or the position just doesn't make sense.
I'm looking at this report from your department from April, showing that more people in Florida are seeking religious exemptions for vaccines, and at the same time, Florida is seeing rising cases of hepatitis A and whooping cough and chickenpox. This is in your own report, your own department's report. Before you made this decision to try to lift vaccine mandates for Florida, which include obviously public schools, did your department do any data analysis? Did you do any data projection of how many new cases of these diseases there will be in Florida once you remove vaccine mandates?
Absolutely. So absolutely not, because it's not you mentioned whooping cough there. So there's this conflation of the science and sort of what is the right and wrong thing to do. So scientifically, you mentioned whooping cough. So that's an example. This is part of the issue with informed consent. That's an example of a vaccine that is ineffective. The data show that it's ineffective at preventing transmission. So sort of mandates with that really don't have anything to do with the notion of transmission. And then in terms of, analysis, well, ultimately, this is an issue very clearly of parents' rights. So do I need to analyze whether it's appropriate for parents to be able to decide what goes into their children's bodies? I don't need to do an analysis on that.
So you're trying to lift the vaccine mandate in Florida, and your department and you did not even do a projection as to how this could impact public health. So you have not prepared hospitals in the Florida counties most at risk with the best treatments for any outbreaks of measles, mumps, rubella, whooping cough, polio, and you have not looked into how many kids might now get these preventable diseases? That's what you're saying?
No, that's what you said. what I'm saying is that it's an issue of right and wrong in terms of whether parents should be able to control, have ultimate authority over what happens to their kids' bodies. And in terms of outbreaks, we do have outbreaks in Florida, just like every state, and we manage those. So there are no new special procedures that need to be made.
Right, but you're talking
When we
about
have outbreaks of
doing
different
something that no other
diseases,
state
we
has
manage
done.
them just as always.
But you're talking about doing something that no other state in the United States has done and removing the vaccine mandate for public schools. You're making a decision that no other Surgeon General in the United States has done. It goes against what's recommended by every top medical organization, including the AMA, the American Academy of Pediatrics, the Boston Center on Emerging Infectious Diseases. It goes against what parents in Florida want. 82% of parents in Florida schools said public schools should require vaccines for measles and polio with health and religious exemptions. It goes against what Senator Rick Scott, a Republican from Florida, wants. He thinks sticking with a religious exemption is fine. It goes against the Florida Medical Association, which in the past has backed Governor DeSantis. So all of these people are wrong, and you are right.
Again, sort of casting it in that way is not what I would do. Is not how I look at it.
It's a fact.
You look at the last. I would say what I would say is that, my history, if you will, is I share what I believe is the right thing to do, whether it's popular or not. You have sovereignty over your body. I mean, that's where it starts, and you should be able to decide what you put in your body. And if you can't decide what you put in your body, I mean, what do you actually, what can you decide?
I know a veteran of the war in Iraq. He's a big Trump supporter. He's a big MAGA guy. He has a kid who is immunocompromised, who cannot get vaccinated. It does not have a strong enough body to take an immunization. He is relying on the kids in his class to be vaccinated so he doesn't get those diseases. That's what President Trump was referring to in his comments. What is your message to the parents of immunocompromised kids who are relying on most kids being vaccinated so their kids are safe? You talk about liberty and freedom for parents, but it seems like you're removing liberty and freedom for the parents of kids who are immunocompromised.
Yeah, I think it's an interesting way to conceive that, to sort of describe that, but I don't think that's the dynamic at all. Ultimately, obviously, we're all very sympathetic to children and families who have to deal with chronic illnesses. And, I'm a parent. We care about our kids more than anything. At the same time, it's important to recognize, just the difference between right and wrong. And ultimately, however, whatever the challenges are, and by the way, the challenges for being immunocompromised, I mean, they're really significant, and they extend way beyond just the diseases that we have vaccines for.
Did you vaccinate
And
your kids?
Jake,
your kids
really briefly,
vaccinated?
I'll just say one other thing. Jake, just really briefly, one other thing. Again, this whole, Florida hasn't done any analysis, that's nonsense.
You said
again,
you hadn't
we
done any
handle outbreaks.
projection.
We don't need to do. The way you're portraying it is nonsense. We don't need to do any projections. We handle outbreaks all the time. So there's nothing special that we would need to do.
All right, Surgeon General Dr. Joseph Ladapo, thank you so much for your time, sir. Appreciate it.
Thanks.
Let's bring in Dr. Paul Offit. He's a virologist and a pediatrician who is a member of the CDC Vaccine Advisory Committee and has fiercely disagreed with HHS Secretary RFK Jr.'s criticisms of vaccines. Dr. Offit, what's your reaction to what you just heard from the Florida Surgeon General, Dr. Joseph Ladapo?
He's confusing two things. First of all, Florida has a religious exemption to vaccination. If you don't want to be vaccinated in Florida, all you have to do is fill out a one-page form. When he's talking about eliminating mandates, he's talking about eliminating one of the two most important weapons he has during an outbreak, which is mandates and quarantine. If there was an outbreak in a school, as there was last year in a Catholic school in Florida, if you're not going to mandate vaccines, if you're going to say you can come into this school even if you're not vaccinated, he is going to have a very hard time controlling those outbreaks. I mean, school entrance requirements have been on the books for decades, but in the 1970s, they weren't enforced. And so you had these massive outbreaks in Los Angeles, Detroit, Alaska. And it wasn't until you had school entry requirements, mandates, before you got on top of that. And as you know, as a Philadelphian, in 1990 to 1991, we had a massive outbreak in Philadelphia, 1,400 cases, 9 deaths. It wasn't until we mandated vaccines for school entry until we could, which allowed us to stop those epidemics.
So many of the decisions when it comes to vaccines, when it comes to mandates, have to do with data, cost-benefit analysis. If there's a medicine that hurts 1 out of every 2 million people but helps everyone else, just that kind of comparison. Were you surprised when he admitted that he had not done any sort of data projection as to what the results of this vaccine mandate could be?
Yes, here's what upsets me the most. You have this tension between, on the one hand, public health and medical freedom. He is representing the medical freedom movement, which is to say, I'm going to do what's best for my child. I don't care about how that affects somebody else. Whereas in public health, you do care about the person next to you. And I think President Trump alluded to that. He has just seriously crippled his ability to get on top of epidemics should they occur. And given that attitude, I have no doubt they will occur.
All right, Dr. Paul Offit, it's always good to have you on. Thank you so much, sir.